Thanks for joining us on American Medicine Today. I'm Kimberly Bermel, joined by my friend Ethan Euchre.
I'm glad to be here.
My other friend, Senior Fellow Jeff Wagstaff.
Yes, I am. Thank you for having me.
How far will America's drugs companies go to make profits? Well, joining us right now is Dr. Robert Marx, whose debut novel, Deadly Prescription, details his real-life battle with Big Pharma over the sales of dangerous prescription medicines. Thanks for being here, Dr. Marx.
Well, thank you. Nice to be here, and thank you for having me.
You know, one of the things that strikes me, and I was reading in the show prep, there are things like Fosamax, if I'm pronouncing that right, but it talked about the decay of the jawbone. And my mother and I were looking into this because it's supposed to help osteoporosis. And these were things that they were trying to put my grandmother on. And we started to research it. And Fosamax, if I'm not mistaken, has some of the same components as like a Drano. Am I correct?
No, not exactly.
Okay.
Fosamax is what's called a bisphosphonate. What it does, though, the dark side of it, it kills a normal cell in the body that rejuvenates bone. And to be fair, it is a therapeutic advantage, but for only 3 years. After 3 years of taking it, then it starts reversing, making your bone brittle, which can get either exposed to the mouth and cause infections, or cause breakage of your upper leg called the femur. And the orthopedic surgeons have found an inordinate number of these.
It's interesting because you would always see the stars on TV and, oh, I take this, I take that for osteoporosis. And pretty soon they kind of fell by the wayside and you don't see them anymore. And all of a sudden you hear that they've broken a certain bone and you go, oh, and they might say jawbone. But obviously the medicine isn't that targeted to only affected jaw.
Well, that's true. One of the problems, particularly with Fosamax, is it's double the dose of all of its competitors. It is at 70 milligrams per week, and then the others like Actonel, Telvia, and Boniva are only 35 milligrams. Essentially, they market it so that they tell postmenopausal women to take it the rest of their life, but they only studied it for 2 years.
Isn't that dangerous?
Absolutely. Not only that, but I was shocked to find when I was asked to review all of this that they essentially didn't look for complications. That nobody looked in the mouth, although if you know the mechanism of how this medication works, that would be the area you would predict would cause the problems or have the problems be seen in. They were absolutely naive about that. And then when they found out about it, when we as surgeons brought it to their attention, they denied it and trivialized it.
Oh, well, of course, because it's going to affect the bottom dollar.
So, Dr. Marx, how did you find this connection, this correlation between this particular drug and the decay of the jawbone tissue? And then what was the reaction of Big Pharma when you released these results? I'm sure they were pretty happy about it.
It was actually fairly straightforward. When you see a whole group of patients come in with dead bone in their jaws and you take a decent medical history, you find that the common link is that they were taking this class of medications we call bisphosphonates, of which Fosamax is really the number one oral producer of this dead bone. And then you know the mechanism of how this drug works. You put 2 to 2 together and it's very obvious. They reacted to it by denying it and challenging us and trying to criticize us for bringing up a false accusation and things like that. It was pretty sinister.
Dr. Marx, in some of the research that Ethan put together prior to us talking to you, it states here that drug manufacturers routinely cover up evidence of the dangerous side effects caused by their products. That not only does that seem irresponsible, it seems immoral and criminal. Could you give us some examples of how pharma's done this?
Well, exactly. Essentially, if you take a look at the Vioxx scandal, now Vioxx was the greatest painkiller we could ever find because it was not narcotic. However, they published an article in the prestigious New England Journal of Medicine denying any association with heart attacks, yet 139,000 Americans developed heart attacks from Vioxx. And what they did is they compared it to naproxen, which we know as Aleve, and the whole article talks greatly about how wonderful the pain control is with Vioxx, and then makes about 4 sentences about how naproxen protects the heart. Well, actually, naproxen does not protect the heart. It was in their study that there were 4 times the heart complications in the Vioxx group than there was in the naproxen group. So they used a very fancy study with great statistics to cover up the obvious.
The part that's scary is that these are huge corporations. And so I have this vision of people sitting around a boardroom and these things come up in conversation. Well, we're concerned about these issues. I just can't like I can believe it. It's just hard to comprehend that people would purposely market a product that they know is going to be damaging to people for no other reason to generate profits.
Well, that was my shock, too. Maybe I, as even a surgeon, was a bit naive. But to prove the point, if you will indulge me, I have an email. Now, you know, in the last election, the emails got to be certainly a big campaign issue. But here is an email from one of the higher-ups in Novartis Pharmaceuticals. And he says, I'm going to read this as a quote, "I was surprised to read below that we are studying 2 milligrams of zoledronic acid in Japan. A 2 milligram dose in Japan runs the risk that physicians will start using only 2 milligrams for these diseases, cutting our revenues in half. If that dose was to bleed into other markets, the global impact on sales could be very large."
That's unbelievable.
Yeah, that shocked me, too, when I saw that. That came out in a courtroom, and it was pretty shocking to even the jury. I was flabbergasted. It was kind of a wake-up call to me, and I think to a lot of the people out there.
One real quick thing, because we're just about out of time, Dr. Marx. Tell us about the book. Why did you decide to make Deadly Prescription a work of fiction?
Because if we have this in the academic circles and the political circles, the average citizen doesn't get to know about it. So I wanted to get to the person who really counts, the reader, the American public, in a hopefully entertaining fashion that they can read and enjoy a mystery novel and also learn about the dark side of Big Pharma today.
We've all seen the commercials for these things, and they go in with side effects, contradictions, warnings, and then they say to see a full description, see our insert. Meanwhile, the commercials go on for minutes on end.
The inserts are 25 pages of fine print. To your listeners, I would advise go directly to what's called the black box warning. That's the most serious and the most common side effects that the FDA requires that they put on.
Because I think it's an effort to desensitize people. Like, oh, if I have a side effect, it's just par for the course.
Yeah,
and
they
it shouldn't be.
rattle through so many of them that you just sort of say, oh, that just happens the way it is, and you don't really take them seriously.
Oh, yeah, and some are like tuberculosis or sudden death.
Yeah, they're terrible.
I mean, I'll take my chances suffering with, sniffles or something.
This will help your headache, but your foot will fall off.
Right. Well, Dr. Marx, that's actually a really great point. Any other tips for consumers when it comes to taking prescription drugs, given all the unethical practices that Big Pharma partakes in?
Talk to your doctor very seriously about the side effects, not so much the beneficial effects. And number 2, go on the internet and Google your drug that you're taking and look at the other side of the coin, because that will often be printed with different articles.
Scary stuff. Thank you so much for bringing this to our attention. Dr. Robert Marx, whose debut novel, Deadly Prescription, details his real-life battle with Big Pharma over the sale of dangerous prescription medicines. Thank you so much for taking the time to be on our show.
You're welcome, and thank you for having me once again.
Thank you.